Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Oseltamivir. Its brand name is Tamiflu. And before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. So Oseltamivir inhibits influenza virus neuraminidase. This affects viral particle release. In terms of indications for use, Oseltamivir is indicated to be used in the prophylaxis or treatment of influenza or the flu for both virus A and virus B. It also has an off-label indication to be used for avian influenza or avian flu. Now, before somebody was to use Oseltamivir, there's a contraindication that they must clear, which in this case would just be a hypersensitivity to Oseltamivir or any other component of the product. And there's also some precautions and warnings that they should be made aware of. Dermatologic skin reactions have occurred while using Oseltamivir, such as Stevens-Johnson syndrome and toxic epidermal necrolysis. The medication should be stopped at the first sign of any of these occurring. Because this medication contains sorbitol, it may cause dyspepsia or upset stomach, as well as diarrhea in patients who has a fructose intolerance. The intranasal live attenuated influenza vaccine should not be used within 2 weeks prior to or 48 hours after Oseltamivir. Patients should be made aware that anaphylaxis has been reported with the use of this medication. Abnormal behavior and delirium may occur with the use of Oseltamivir, but this is more of a concern in pediatric patients. Dose adjustments may have to be made if patients using this medication have renal impairment. And if they have end-stage renal disease, the use of Oseltamivir is not recommended. And once somebody is cleared of the contraindication and made aware of the precautions and warnings, and they start to use Oseltamivir, the exact dosing that they use would depend on the reason that they're using it. If they're using Oseltamivir to treat influenza or the flu, they may use 75 milligrams twice daily for about 5 days. In some situations, if the patient remains severely ill after 5 days, treatment will be continued. If they're using Oseltamivir prophylactically to prevent influenza, they may use 75 milligrams once daily for 10 days after being in contact with an infected individual, or up to 6 weeks if there's a community outbreak. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using Oseltamivir, so I'll go over some of those here now. Up to 10% of patients may experience nausea. Up to 8% of adults may experience vomiting, but the percentage would increase if a pediatric patient was using this medication. Headaches may occur while using this medication, and the percentage would increase if they're using the medication prophylactically. Now, some more rare but serious side effects would be the dermatological side effects that we discussed, such as Stevens-Johnson syndrome and toxic epidermal necrolysis. Some patients may also experience swelling of the face. Gastrointestinal hemorrhage and hepatitis are possibilities. We mentioned that anaphylaxis may occur, as well as abnormal behavior and delirium. That's all we're going to talk about today with Oseltamivir or Tamiflu. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.